Susan, I am making you the host, so you have
Okay.
full control. And good
Oh,
luck,
good.
guys. Take care.
Thank you. We're going to need it.
Thank you.
Thank you. Well,
Okay, roll. Go ahead.
Susan, I was just going to officially welcome everyone. And Susan, if you would take the roll, please.
Carol Rodriguez,
Present.
Liz De La Perouse,
Present.
Wayne Flesh,
Present.
Dan Rosenthal, Lillian Eunice, Deborah Granderson, Lisa Hotley,
Present.
Lisa Knoll. Okay, you do not have a quorum.
Okay. So my question to Max, I know there were several changes that needed to be made to the minutes. Can we have that discussion, although we will not vote on the minutes until our next meeting?
You can discuss things today. You just can't do any votes because that wouldn't be official.
Okay, thank you. That was my understanding. I just wanted to make sure we were clear on that. So for the minutes, I know that I let Susan know when we had a discussion about the list of those present, and so we will be making those changes. And were there any other items on the last included in the last minutes that people wanted to discuss? I had one under gram pads. It says Chairwoman Days ordered the item be reviewed and filed. Susan, is that from this meeting or is that from a previous?
It should have been from the last meeting because I didn't
Okay.
have, I wasn't filling in an old minutes thing.
Okay.
I started over, so.
I just wasn't present at the last meeting, so that's why I had a question in regards to it.
I'm gonna pull it up and check it here in a second, so.
Okay. Anyone else have comments in regards to the minutes that they would like to see amended? Nope. Okay. So Susan will make changes to the present and absent list, and we will have this as a voting item for our next meeting. So thank you. Returning to our agenda, we can start with old business. The gram pads program. Wayne had a question prior to the beginning of the meeting regarding have all of the gram pads been distributed? And my understanding from the library is absolutely yes. All of the gram pads were, the additional gram pads were all distributed. The original gram pads were renewed or added to the list and distributed. I believe that individuals that are interested in a gram pad can continue to contact the library and be added to a waiting list. I know throughout the course of the year, there are situations where someone may no longer need their gram pad and will be returning it to the library, or someone is deceased and the family is returning it to the library. So the gram pads work like a book. You're supposed to return when you are finished using the gram pads, although gram pad users, were given the opportunity to renew because we understand the success of this program. So Wayne, did that appropriately answer your question?
Just for the record, the total that you referred to is 3,000.
Correct.
Correct. Okay, so that for the record.
Yes, thank you. Anything else on grandpads and the library?
The one thing I can sort of mention is that I will be meeting tomorrow with the St. Andrews Charitable Foundation. And one of the things I'm going to discuss with them is supporting grandpads.
Great. Also, Lisa Knoll is traveling and was unable to be here today, but Lisa has been working very closely with the library on a new initiative which falls under funding through the Older Americans Act, which funds the area agencies on aging, that would allow for coverage of the grandpads for recipients of the meal program. So it could be, they're looking at this being an add-on service to individuals that are receiving home delivered meals. And so what they were, last time I spoke to Lisa Knoll, which was several weeks ago, they were working on finding out the number of grandpad recipients who are also home delivered meal recipients, and looking at home delivered meal recipients to see how many of them might be interested in becoming in having a grandpad and qualifying for a grandpad. Many of the home delivered meal recipients are also Medicaid recipients, because that can cover home delivered meals as a service. So this is one of the ways we're looking at ongoing sustainable funding if it works. I think Lisa Knoll and the library are to be applauded for thinking outside the box on this new approach, because nobody else in the country is doing something like this, but they seem to be in full compliance with what the regulations allow. And I think a lot of people are very interested in this new approach. I believe since the last meeting, the library also was awarded a statewide recognition as an outstanding library system. So, you know, we're all very proud of our partnership with St. Louis County. I know I voted yesterday at my local library and it went smooth as silk. I was just so impressed with how organized they were. So anything else on grandpads? You guys are a quiet bunch today. But that will end. I'm going to turn it over to Liz for St. Louis Financial Protection Coalition. I know they had a half-day workshop, and I appreciate your attending. And if you could give us an update on the workshop as well as kind of next steps in that process, that'd be great.
Yes, I'd be happy to. So we did have a wonderful retreat. It was really organized by Lisa Knoll as well as Mary Tucker. And the coalition had got some funding from the Lutheran Foundation, which enabled them to hire Catherine Edwards to kind of organize this group. They hired another group, I can't remember, up into three pieces. One was sort of an introduction, and then we broke out into workshop groups. There were three different groups. I was in charge of the advocacy group, which was really the group that's supposed to be working with legislators and other government officials to raise awareness on elder abuse or financial exploitation. In that breakout session, we had to elect a chairperson and a co-chair. So Nicole Lynch is the chair of the advocacy group, and I am the co-chair. So the big thing that I'm still not on top of is that there is legislation that has been proposed that will enable financial institutions to have easier access to bank records. Right now, that there's a blockage going on. So I don't fully understand this. So Nicole and I will be meeting this afternoon with Tim Jackson and get more information on that. One of the things that we will be doing is, again, the Advocacy Coalition, or arm of the coalition, will be meeting again in December. And we anticipate going down to Jeff City the beginning of the year to get to know the Lieutenant Governor and his office, and meet various legislators who are a part of this effort. So I think that the coalition is still, kind of finding out what its different roles are. So that's and I'm learning more about. I did talk with a friend of mine yesterday who is a CPA, and so far I have an email into Mary Tucker about whether or not CPAs have been part of this coalition in the past, and if so, what is their role? Do they? Is there a reporting requirement on their part? So anyway, that's where we are, and so I'll probably just keep this group up to date on what we're doing and how. Anyone got any questions? Yeah.
So
Good.
I just thanks, Liz, and it's really nice to see this group that has worked strictly on a volunteer basis for years, getting a little bit of grant funding to be able to kind of take it to the next level. For those of you, Nicole Lynch is the policy coordinator with Voice, which is the advocacy group representing individuals in long-term care. They do advocacy, but they also have a large set of core volunteers that go into long-term care facilities and kind of work as mediators with the facility representing residents. So she works on legislation and also has been really involved with this coalition. So that's exciting. And Liz, if you feel it might be appropriate at a later date for Nicole to attend one of our meetings and maybe give us a brief update, I think that that's something to consider.
Yeah, and then the other point that I forgot to mention was that there has been quite a lot of money that is being given to the various government agencies that are, focused on older residents to beef up some of their programs. So I'm not entirely sure how that's going to, actually play out. So that will be something that that I'll be learning more about in the next couple of days.
That sounds good. I believe the legislation and certainly, we want to look at that legislation. A number of years ago, Missouri passed legislation. This was probably 10 years ago that dealt with broker dealers, and when a broker dealer with a financial institution had a concern about shifting of funds, they could put a freeze on that action for a certain amount of time and could do some investigation, working both with Adult Protective Services as well as it gave the broker-dealer the ability to contact another member of the family or another contact to discuss the concerns. And I worked on that legislation with the Alzheimer's Association because it was a huge issue for people with Alzheimer's disease making, unfortunately, poor decisions and not realizing the decisions they were making. But broker dealers were locked into this relationship with their clients. So I think it was a positive. Financial institutions such as banks were not included, which was an issue at that time. So I am thinking in my process that this is kind of that next step to try and strengthen this by including financial institutions. So I think looking at that legislation is important.
Yeah, and this is why, again, I sort of thought of the CPA component, because all of these services have are kind of eyes on the financial situation of an individual and can raise a red flag. And I think one of the big issues that I have with all of this is, so what? I mean, if somebody, what I've heard over and over again from just people talking is that, yeah, well, what can we do about it? And I think that's one of the big issues I have, is that it seems to me that it's very hard to know, short of a criminal activity, to one just taking advantage and maybe self-serving a little bit. Where is the middle ground in here, and who kind of weighs in on that? So how can you stop a close family friend from convincing the older person to give their charity $1,000 when that really maybe they don't have that $1,000 to give? Where is how can you stop that kind of activity, and who is it to stop it? So I think there's a lot of questions that still remain.
Yes.
Liz, could I ask you a question?
Sure.
Do we have any comparisons to other states, and are there any processes in place elsewhere that we could look at to see if we could at least make some proposals? Because I'm not sure. I know that it's difficult. That's a universal issue, particularly when it's exploitation from a family member. But I'm wondering if there are other states or cities that have some sort of process in place that we might at least bring forward, when you're doing your advocacy research, find out, are you aware of anybody
Yes,
who's doing well? I know the state of Oregon has a really robust program all the way through and I'll tell you a little bit about this proposal from the state of Missouri right now for this aging in Missouri, some new research. But anyways, I was just going to throw that out there to see if you knew of anything else.
Yes, actually there is. And Catherine Edwards has sent all of us links to the most, so I think it's Minnesota that has the strongest rules and regulations in place. And California is also strong. I might actually, if you're interested, Lisa, I can send you that document, which was shared with everyone on the coalition, with all of those links. So yes, I think that's one of the big issues that is sort of difficult, is that it is state by state. So how do you, in many cases, the person who is being exploited may not even be in the same state as the person who is doing the exploitation, so who has jurisdiction over it. So yes, it really kind of, I find it mind-boggling in a way to see how you can get it.
Yeah,
Well, I think it's timely, as I mentioned, that I actually met with Jamie Opsel, who was going to try to make the meeting this morning. But we looked at, there is this SCAN grant that is, and California has completed it and it's being used as a model, but it's basically, aging in Missouri. And UMKC was chosen to hire the contractors that will put this data together. And so one piece of that, if it's a true, complete picture that we're looking for, obviously one piece would have to be elder abuse and financial exploitation. So I don't know though. I'm just actually going through California's right now to see what that model is. I've been talking to Jamie about that and another grant. So I think, yes. So if you have any information, I'd love if you'd forward it to me.
Sure.
And I just want to sort of overlay that with the states that have done it and see how much of the, see how that folds into the framework for this aging in Missouri, this new project.
Yeah, okay, great. And I think this is a lot of what we're wanting to do is to make sure that everybody is working, together on this. So that would be great, Lisa. I know Jamie was at the retreat and a part of the whole. Great. I will most certainly get you that information.
Does anybody else on the call want, Liz, would you copy me on that as well?
Sure, happy to.
Curiosity. And I think it's really important. I know at the federal level, the Justice Department, I mean, this is something that they are looking at, that's important on the federal level, but it is very fragmented because it's different state by state by state. So I'm excited to see Missouri taking some steps to move forward. And the lieutenant governor is actually designated, we talked about this previously, designated by statute to be the senior advocate for the state of Missouri. So he should be a good resource in terms of what is important legislation to for older adults in our state. And so good to be meeting with him. Great. Anything else? It's nice to see this important work continuing to move forward. So Wayne,
Yes.
you can hear us and we can hear you. So Wayne attended the circuit breaker strategy meeting recently. And Wayne, if you could kind of give us an update on that meeting and kind of what transpired during the special session and what is next.
Okay. Yeah, that meeting was on August 31st. And since then, they met in that special session, and it was for tax relief and everything and whatever. But none of that really was allowed to be submitted in the legislation. So we did, it's interesting, there were two items they went into the meeting with. They wanted some action on all of these issues, and that was they were not permitted to add anything to any of the bills or whatever. So that is being put off until the January session. But we have a meeting scheduled to research and plan that, strategize on it. The other one was the one where we had renters and landlords, owners, who were feuding somehow, and I didn't understand it at all, but this group seemed to make say, well, it's where they were the concern with the legislatures is that the renters were not paying taxes. Well, the renters were paying taxes, and it was being handled through the landlords. And that simple point, and I'm not sure, because it's so simple, I'm not sure I understand it all, but that simple point was made clear. And then, as I understand it, it was resolved. And now the legislatures know that those folks are paying taxes through their rent, and well, everybody's happy. Anyway, that was a side issue, but if this group resolved that, I think that was a big accomplishment. Anyway, we have received a correspondence from Lindsay Baker, and Lindsay is our contact person there, and they are scheduling a follow-up meeting on Monday, November 14th, virtual, 2:30 to 3:30. Now, Carol, myself, and Jamie Opsel are on the mailing list. So we have that, and I suspect that all of us are going to join. But I'm sure other individuals would be welcome if they would like to get on the mailing list and whatever. And I would be glad to submit those to the strategy group and include them in the session. It's for 1 hour on November 14th in the afternoon. And I've been very impressed with this group, and I believe our connection with them is healthy, and we should continue it. And as a result, I have requested a listing of everybody that was at that meeting on the 31st, and their contact agencies and whatever, who they're representing. And we are using several of those names as we talk about other programs. So I thought that maybe if we had a listing of them, then we could see cross references and whatever, and that could be very helpful. So I'm hopeful that Lindsay will be getting that to me in the next day or so. So, so number one, I would like to know if anybody else is interested, and I will be getting the list. And this is all planning for the January session. And again, I'm impressed with this group. They represent many agencies in the community. I think I said there were like 18 members at this meeting, and they were all prominent agencies, representatives. I mean, like Paraquad was there and everything. So, and representing agencies who serve the people. So that's where we are with this group, and I'm anxious to see what happens with our meeting on November 14th, and maybe in January they'll allow some of these proposals, requests to be addressed.
Wayne, this is Sue, and I'd like to be added to that list.
Sue, okay?
Great.
Wayne, that's certainly going to be something that we are going to want to bring up if we are meeting, if Nicole and I are meeting, and anybody else is meeting with the Lieutenant Governor. So anything that has to do with helping, older adults, we should have on our kind of, for lack of a better word, the sheet that we leave with the Lieutenant Governor to, so that he knows where the priorities are.
Now, is she not on that list?
Wayne, I would think that Nicole is part of that group.
I think her name is on the list.
Yeah, I would think so. So that would be, yeah, I would absolutely think so. So
Okay.
this is, kind of is a little bit of a, as you recall, gosh, it's been over a year because it was last summer. We met with Senator Brian Williams
Right.
from University City. And Wayne was at that meeting, and Zulema Tang Martinez was at that meeting. And the reason for meeting with him was our concerns that we were hearing about elders in our community, and their fairly dramatic increases in property assessments, resulting in increased property taxes. And for individuals with lower income, this was really a stressor. So we brought that concern to Senator Williams. Several bills were filed last year. There were concerns from several senior advocacy groups that if this legislation passed, it could, in the form that it was written, it could potentially decrease revenue going to senior funds, such as the one in the city. And so Missouri Budget Project, Lindsay Baker is one of their key staff members and researchers, and incredibly bright, started looking at circuit breaker, and there were changes that could be made to the circuit breaker. So this is really the approach that seems to be moving forward, seems to be more viable. And they were looking at increasing the income level to qualify for circuit breaker, and possibly the amount that could be saved, increasing that cap as well.
Okay. Nicole?
Does that provide a little more background?
Yes, that's very helpful. And Nicole Lynch is on the mailing list. She's with Voice?
Yeah.
Right.
Okay, all right.
Any other questions?
Does anyone else other than Susan, Liz, would you like to be on this list or?
Well, I'll tell you, I would, and then at the same time, I probably am I'm probably getting it through Nicole.
Okay.
And so as I said, I'm meeting with her this afternoon, and
Okay.
we'll talk about whether or not
Okay,
how
well,
that goes.
just so you know, the Monday, November 14th is coming up. And
Right.
so you can chat about that. But anyway, if you want to get on it, I'm sure you'd be welcome. So,
Thank you, Wayne. I'll get back to you on that.
okay, all righty.
Any other questions in regards to this? So I think that there will probably be legislative issues, both coming out of the Financial Protection Coalition, as well as legislation around the circuit breaker. So those could potentially be pre-filed as early as December 1st, although I don't know if those bills will be ready to rock and roll by December 1st. But that being said, I think this is if we are going to support these initiatives, this is something we'll want to vote on, possibly at the December meeting. Mac, do you have any parameters we should be thinking about in terms of taking action on these state initiatives?
I don't. I do need to kind of read kind of your bylaws and mission to see what your what the parameters are of this committee, but nothing comes to mind right now.
Carol, I think what we've done in the past, that I think we would probably do again, is send a kind of support for whatever the legislation is to the county council and to the county executive, as in our capacity as advisor.
Yes. Thank you, Liz, for reminding us of prior action.
Okay, Connie.
So
Thank you.
any other questions? Wayne, thank you so much for that.
Quite welcome.
So next on the agenda is report out from Susan at CORE, as well as Aging Ahead. And since Lisa Knoll isn't here, she said she might email me. So I'll check my email. Susan, you want to take it away for any
Sure.
updates from CORE?
Sure. So I guess the most exciting thing that CORE is doing right now is we are bringing the legal program back after the first of the year.
Yay.
So, yes, it'll be a good thing. It's just taking a little bit of time in terms of finding an existing position that we can dedicate to it and then getting someone hired. So once that happens, we will start our legal program to do documents for older adults. Other than that, we are doing our Adopt a Family program again this year, and that's going pretty well. Yeah, I guess that's about it. We're just going along doing what we're doing. We are losing 2 staff members on December 1st, so that's not a good thing. But hopefully we'll get those positions filled and keep moving. So that's about it.
Susan, how does Adopt a Family program work? Can you elaborate a little?
Sure. The Adopt a Family program, it actually is the St. Louis County Adopt a Family program, but I do it. So it's sort of housed under CORE, I guess. And we get nominations from caseworkers, social workers, from various places, schools, other agencies, county government agencies or programming that works directly with people. And if they're families in need, they range from single older folks to, I guess the biggest one we have this year, I believe, has 6 children in the family. And there's various family situations. We get the nominations in. I compile them into a catalog with a brief description of each family and then like a wish list of what each family member wants. And then people, individuals, families, companies, just work groups, whatever, ask if they can adopt a family. And so they read through the catalog briefly and select a family, and then they buy gifts. We do ask that the gifts be new for the most part, just because a lot of the families are not used to receiving new items. So we want them for the holidays to have something new. And then we do a big gift delivery distribution where we have most of the time the families come in to pick up the gifts. And then if they can't, then we get them to them. We do some delivery ourselves. So that's pretty much it.
Is that something we could maybe, I know we don't have a zillion followers on our Facebook page, but I think it would be a positive thing that maybe we could post a link. Is that, Lisa
you
Hotley, is
can.
that something we can do?
Yes, it is something we can do. And Susan and I are actually going to be meeting with Peter
Yeah.
Gleichert, I believe is his last name. And that's the IT individual that he and I were supposed to meet this summer, and he ended up having to cancel, and we haven't rescheduled. But that would not only allow us he's going to walk us through where we might be able to place information, getting a page back onto the county's website with some of the data that we had for older adults. So, but in the meantime, we have our unofficial St. Louis County Older Adult Facebook page. So if Susan, if you could forward me just a little overview of that, or if you have a flyer or something, whatever you've sent out, do you have a call for goods, or is that all done? Somehow we could promote that on that page. But if you're looking for organizations to adopt, or if you're looking for donations, either way, whatever you send me, I'll be able to put out there on that page.
Okay, we can talk about that. It is actually on the county website. You have to kind of look for it. And apparently when you Google it, our program comes up like first or second on the listing of adoptive families in St. Louis. So we've actually had very, very good success getting adopters. This year, we've struggled a little bit more getting families in the program. So we've got fewer families than we've ever had. And we discovered that part of that was because the social workers in the schools, the school counselors, are asking to do double duty in that the districts are putting them in the classrooms now because they're short of teachers. So they are not being, their time isn't dedicated to doing the school counselor role or the social work role and that's been done in the past. So I think that's one of the things that has kept us down a little bit, but we still keep getting nominations in. And so I keep adding them to the catalog. And so it works pretty good. It's been we've been very fortunate with the program and the outreach of people who want to adopt each year. So it's been good.
Great.
But yes, I will forward information.
Any other questions? Lisa, I'm really pleased to hear that you're meeting with Peter and seeing if we can get some stuff back up on the website. And
Carol, the timing, particularly, I'm also meeting with Gina Traver from the health department. Spring Schmidt left, and so I'm going to meet with Gina. I think it'd be great to have her come speak with us again, but they're in the midst of their CHIP, their county improvement plan, which is the county assessment. And we wanted to talk about older adults and what that assessment is calling out specifically, because that's been one of the concerns with the Missouri assessments, is that certain health determinants haven't been tracked. And so we're looking at that. So I'm going to be meeting with her in a couple of weeks and we'll kind of go through that. But again, that's that kind of information that we should be linking, and being able to promote. And all of that used to be on the website at one time when we had an older adult page. So that will show up on the health department's page, under public health, but it doesn't show up under older adult, where we could break out what's relevant for our residents. So that's something that I'm hoping Peter will be able to help us through as well. And so Susan and I, like I say, Susan and I will be meeting with Peter, I'll be meeting with Gina, and then we'll kind of pull that all together. But once we have a conduit where we have a place to share this information, I think it'll be great for all of us, and definitely for residents looking for what we're tracking and what kind of resources are available.
yeah. So Lisa, the age-friendly plan has just kind of morphed into, I don't know where. I mean, it's nowhere to be found. And I realize that plan is, 7 years old. But I do think it's an important document that a lot of work went into. I mean, you were on that committee. What are people's thoughts on asking if that could be posted again? Or am I asking for some ancient document because it's, not?
I still have it.
I have a hard
I have
copy
it.
and I refer to my hard copy, but if you
Yeah.
go online, it's no longer there, to the best of my knowledge. I mean,
It
you
is
might
not.
be able to get it through AARP, or
Yeah.
the World Health Organization. I don't know, but it's to me, it's a little short-sighted, especially since it is still a relevant document to decide the general direction of what we are doing.
Carol, I kind of agree that document is helpful. I think one of the big things that we're hearing a lot about right now is transportation. And there's a lot of money and resources in general that are going towards improving transportation and walkability and all of that. And I'm not as up on that as I should be. I know within my small community here, it's there's a lot of talk, but I don't know how much of the safe streets are being followed. So certainly important.
Yeah, I agree, Liz. So Lisa, what are your thoughts on that, since you're the one who's going to be meeting with Peter?
Well, the whole older adult, so we had an age-friendly page, but on that was other relevant older adult information. So when that disappeared, back in 2020, 2019, I think that disappeared. When that happened, it's just there's not even a placeholder because the website, the
Mm-mm.
county website was being rebuilt. So we were not included in St. Louis County strategic planning as we were told we would be. And, we've cycled back a couple of months where we discussed that, how we got out of that loop. And so as a result, I think we got out of the website, probably somewhere on that site map. So that's part of what we want to talk about. The age-friendly plan it's more, so it's a certification, but it was a living document that had a 5-year life. And what that's designed, AARP did not, or the World Health Organization, whose program this is, they don't have a next step. But what you can do is look to see what other cities have done. So this was supposed to be 5 years, 2 years of assessment, 3 years of action plan. And that was to get a city to embrace the built environment and to understand those livability factors for older adults. So in St. Louis County, we didn't have that opportunity to do that. So we didn't, we don't have we don't even have the older adult, the same model that we're advisory with no budget. So there's a lot of things where we're kind of parceled out through Susan's program, through Health and Human Services, through the planning department. So that's part of what we wanted to talk about. So the bigger picture is, yes, that age-friendly document is very relevant, but it's what a community does with it after it's planned.
Mhm.
So that was an interdepartmental program where everyone had an action. And I would bet that very few of the departments are even aware of it any longer. So it might be our
Great.
job to bring that back up. So, like I say, I'm working through that and a couple of other things that I'll share during Share Out that will hopefully tie this all together. And then we'll be able to kind of go back and rebuild that and see if we have interest, like at Parks and Recs and Transportation, to see if we have some interest in going back, revisiting that action plan, seeing what has transpired since then, and then kind of looking at where we can go from there. Does that make
That's
sense?
makes a whole lot of sense. So thank you so much, and I'm glad to see you working on that. And under new business, I kind of penciled in, some discussion on, as we're looking at 2023, because that's just over the horizon. But also, who do we want to start inviting to our meetings? I know transportation, to Liz's point, was an area that we said we were going to do a little bit more, trying to, get a footing on what is available out there and what do we have in the county and where are their shortcomings, et cetera. And just trying to get an update, because I don't think we've heard from anyone in transportation since, oh gosh, probably several years. So, but we'll get to that as we go into new business. I'm trying to be good and follow the agenda order here.
Thank you.
Yes. Anything else? Sure. Anything else for core and aging ahead? I did not have anything from Lisa Knoll. Like I said, she is traveling. So I'm sure if there's anything of great importance, we can just shoot an email, but otherwise we'll get it updated at our December meeting. So under new business, I'm so sorry that Lillian isn't with us today. We miss having her present. We still continue to have vacancies, and I am not aware of any action being taken for 2, 4, and 6. Again, to the point that was made, earlier, I'm sure that with the elections, everything in terms of making board and commission appointments, probably this is a busy time for members of the county council and our county executive. So hopefully after the election, we will see some action. I will follow up with Mike Nickel. I told Susan I would give him a call to see. Mike lives in Tricus
District 6,
District
yeah.
and has years of experience working in aging services, both for the state as well as the county, and has been an adjunct professor at Washington University. So brings huge amount of talent. He had expressed some interest, but then didn't really choose to act on that. So I'll give him a call and see if he may have more interest. I think after the election, we need to loop back to county council members for 2, 4, and 6 and see what we can do to move this process forward. I mean, it's just something we've been trying to work on for all too long. And what is difficult is we do not have the authority to, I mean, this is not our choice to move someone forward, and we can encourage individuals to apply, but that is absolutely no guarantee that that person will be selected and endorsed. So so I think our action needs to again be to loop back to members of the county council and the executive, county executive, to make sure that they are well aware of our desire to see this filled. Any thoughts, questions, concerns in this arena?
I think just second, Carol, that we just have to wait until after Tuesday and then contact council people and say that we need those.
So maybe the best approach would be, again, to discuss this in December, because I think any action on our part right after the election may get lost in the fray of action by numerous people. And I really think some personal conversations about the importance of this need to occur so that we can get these slots filled. Comments, questions, concerns?
Sounds good.
Wayne, did you have something?
It sounds like a good strategy. It's really the only one we could take, I think.
Yeah, I think so too. I want to make sure, moving on to commissioner contact information, I want to make sure that we have everybody's most current contact information. So if everyone can send me an address, an email address, and a phone number, best phone number, just email it to me. I can update a roster and make sure that everybody has it. So we have the most current information for everybody. And on your phone, when you list your phone, if it's a mobile and it's both phone and text, if you're okay with texting, if you could just put that there so that we will know if texting is an appropriate way to reach you. For example, with these meetings, if you're not on, if I can send you a quick text and say, where are you? Sometimes that's the most effective way to communicate. But I know not everyone uses text.
So send that to you, Carol.
yeah, if you could send it to me, and I will reach out to other members who aren't on the call today and make sure we have that information as well. And I think that's it. The other thing I wanted to discuss, and I want to apologize for missing the last two meetings. One, I was on vacation, and another, I was dealing with a health issue with my husband. But I wanted us to talk about upcoming meetings, and frequently we have had guest presenters. We talked last year about the possibility of looping back to having various departments come and present to the Older Adults Commission. And so everybody's picture is going wacky. I don't know what it is on my iPad. So I wanted to know what your thoughts are. I wanted to have an open dialogue and discussion about, do we want to have guests at upcoming meetings? This would probably start, I would think, in January. I think December is kind of a rough time for people, just with the holidays, et cetera, although we could think about it. We've got a whole month to invite someone to be a guest. I would like to reach out to transportation. I think that this is something that was, if we return to what are some of the areas of focus, our areas of focus for this year, that was one where we really wanted to just kind of do more fact finding in terms of where do we stand for services for older adults in the county, and are there areas that we need to be looking into, and making sure that the county council is apprised of any areas of concern. So opening it up for input and discussion.
Carol, one of the things that I would be interested in learning more about is, because I've been trying to get my community to recognize that the car-centric nature of the streets is a problem in a bunch of ways. I mean, Clayton Road, having it be 4 lanes, is just has just presented. I mean, we've had quite a few accidents with bicyclists. So it's an issue, as is part of most of Ladue Road. So I'd be curious to know what has been, why did Clayton decide to have the designated bike lanes in the main area, and how has that been helpful? What are the numbers? Why did they come to that decision, and what is happening with that? Is it beneficial? I would be very curious to know.
So that would really be something for the municipality. I mean, that's one of our difficulties is, where is governance by municipality, and where is governance by, where are decisions made at the municipal level, and so there can be 88 different decisions, and then there's the county.
Well, this is it. I mean, I know sidewalks were added in my community down McKnight and Price, and I know, because I drive down those streets all the time, that has a lot more people are using those routes for walking. So you see people on them all the time, and so I think sometimes the changes are, recommended, and people hem and haw about them. Well, will they make any difference? And so that's kind of why I'm asking about Clayton, because they made the investment, they changed the roads, and I know a big, Lisa Hotley, I think you're even more on top of this than I am, but slowing traffic is a big trend. So be nice to see it happen in more of the county.
So maybe
Carol,
where we could start is someone from transportation within the county. And Susan, can you help identify who that
Yeah.
might be? And then ask the question about Clayton, and then if they aren't able to answer it, because who does have the jurisdiction over it? And that will hopefully at least kickstart it a little bit. Lisa Hotley, you've done a lot in this area, and did you have a question or a comment as well?
Just about the return, I think the single most effective way of re-engaging with the departments is to have them come speak to us, because then they do have that information pulled out. They do know to be looking even at older adult stuff. So I think when we invite someone, I think we also need to send them a copy, at least if we send them a copy, they're not going to read through the age-friendly plan, but if we could at least share with them what their actions were, and then that might be a good starting point for their talk, would be to say what's transpired in that time. And then with transportation specifically, yes, there's been a lot going on. As you remember, there was the walking, biking task force advisory board that I sat on. So you've got the state, you've got state roads, and Susan, we did the audits, the walking audits
Right.
several years ago. So county has specific roads, state has specific roads, and municipalities do. So it's been really helpful when the transportation department was able to share that information. But I guess to see an example of success, when we did a walking audit from the Weber Road library branch, we were able to identify specific things that transportation department then they did the walking audit with us, and then they went back and contacted homeowners, businesses, those who had impacted the walkways. We also looked at, and Susan actually has the walking audit papers because it was done at 3 different libraries. I think we did that in partnership with the library, didn't we?
Yeah.
And so anyways, it was, so yes, it does spotlight that. And Liz, then it'd be helpful for the county to know. So as far as the effectiveness of a lot of these, whether it's Safer Streets or whichever model is used, a lot of those changes are just being made. Funding was for them, many were delayed. So as we're seeing the results of that, still looking at pedestrian fatalities, which is, I think, the highest it's been. The last numbers that I saw is we've reached a new peak in pedestrian fatalities, even in some of the areas that have those improvements. So that some of that has to do with the built environment. Some of that has to do with driver awareness. So that's something, yes, transportation could speak to. But I was thinking in terms of speakers is if we were to kind of put together a calendar like we did in the past, if we just all would forward maybe to Carol areas of interest and people that we think would be interested, we could get them all a copy of the age-friendly plan and then ask them to speak and hopefully cover the key departments throughout the year. And then we could add outside speakers as well, whether it's around the elder abuse or funding, any other types of programs and stuff. But I'd love to see the departments so that we can speak to council, which is our duty, is to keep council advised of policy programs and procedures that impact older adults. So I think that's a great place to start.
I think so too. So thank you. Thanks, Lisa. Wayne?
Yeah, and I will put into it. We'll see how this relationship with the circuit breaker group goes, but I'm sure they would be sometime into next year, would be glad to present and speak and whatever. They know what they're doing, and after January, maybe something will have happened. So who knows?
Great. Well, if individuals could, an action will be to send me thoughts on, a guest to present. And I do think if everyone could go back and kind of look at what were our areas of focus, because we're going to be looking at that again for next year. And we're trying to, with the agenda, be guided by those, key principles within the age-friendly plan. So, we have, social and civic engagement. We've always said grandpads falls under that. We have health and well-being, which of course deals with the financial protection provision. We have the property tax relief for older adults, which is housing. So we haven't had that initiative. A specific area that we're working on that is related to transportation. So that may be a good kind of place to start. But we also, to Wayne's point, want to continue to stay focused and not go in too many directions like this. We want to stay focused on some of the things that we're working on now, because I think we're making really good progress in these areas.
If anybody needs a copy of the age-friendly plan, I can send you an electronic copy of it.
Could you just send it out to everybody again?
Sure.
That would be great.
Has that changed at all? I mean, from its origin, is it updated or do we know?
The age-friendly plan?
Yes,
No, there's no update on it.
okay.
There were annual reports that were
There were annual
submitted.
reports. Yeah, and I can send those too. I have those. And I'll be glad to send those out to you also.
When you say send it, you will send it online, right?
Yes. But there was no follow-up. There was no structure. St. Louis County did try to continue forward with it, but AARP and the World Health Organization, who actually are the developers, I guess, of the concept, there was, as Lisa said, there was no next step. There was,
Could there
you
be?
just finished your 5 years and then, they hoped you would continue doing it, but there wasn't a structure. And I think that's what was really needed in order to keep that program moving forward.
Is that a question we should ask ourselves? Should we pursue that?
I think we can. I think it's going to be challenging just because the county, not that they have other priorities and that older adults are not a priority, because I really feel they are, but it's just to get all of the departments on board. What kept it moving forward and what caused the progress that was made to occur was that county departments were held accountable for meeting certain action plans. And so without that, I think all of the county departments, and honestly, since the pandemic, all of our operations are different. They've changed. I don't feel that they will ever go back to the way they were prior to that. And some of that is good because we learned some things. And so if we've applied what we've learned, then change is good. But also there's, all of the departments are faced with the same staffing shortages. And it hasn't been to this point that we didn't have the funding to fill the positions. It was that there's no one applying for the positions. I mean, that's just the way it is. And because of the county's pay structure, I mean, it is tax dollars, so we have to be fairly aware of that. Sometimes we're not always competitive. So that's putting a lot of the county departments at a little bit of a disadvantage right now, not for lack of wanting to do other things and do better, but sometimes if you can't fill vacant positions. And I mean, it's no different than every store you go in and every restaurant you visit, they all say we're hiring now. So the people disappeared during the pandemic. And so I think that's one of the challenges. But I think without that, a formal structure, it's just going to be more challenging.
Okay.
Susan, can what about AARP? I mean, if they were one of the leaders
They were. Yep.
in the age-friendly plan, did they just drop it, or how is that? How does that?
No, they didn't. They didn't exactly drop it. They dropped the age-friendly plan structure, I guess. So for those cities and counties that that followed the plan and completed the plan, there is an ongoing group that meets, but again, it has very little structure to it. So I get emails all the time about these portals that I can go into, and they have open discussions and things like that. And I tried doing them in the beginning, but basically those were programs that were starting out. And that's not, honestly, I didn't feel it was worth my time to devote the time to it because it wasn't where we were. So there's still nothing to continue moving forward.
Would it be worth us approaching AARP and asking them, about the age-friendly plan? And
But maybe when the age-friendly plan was completed, when our 5-year program was done, the county did approach AARP and say, what next? Like, you need to figure this out. Like, what should we do? And at that point, they said, oh, we're going to figure that out. Well, it's been, I don't know, several years, and they have not figured a structure going forward. Like, there needs to be a phase 2 or something, and there isn't. And maybe it's the way it was designed, and maybe it wasn't designed to do that. I don't know. But I think they haven't dropped it, and they still have a pretty robust age-friendly section like on their website. And I get, I think they call them livable communities a lot,
Yeah.
and things like that. They do a lot of that livable community email, and they do booklets that I order and all those things. But it's not the same structure that it was. So, I mean, a lot of work went into that whole effort. And
It's probably, Liz, more a function of that this was born out of the planning department, the county's planning
Right.
department under Lori Fiegel. Then there was the strategic planning when Lori and a small group of planning, I think they became the strategic planning department, which has since been dissolved. But this was under planning, which was why it was interdepartmental. The framework, AARP's true involvement is strictly they pay for the assessment for United States cities. AARP has always sponsored the assessment of the city, which was roughly $20,000 to do the countywide assessment, and we also have that assessment data. But if the city itself didn't sort of weave this into their strategic planning, then the being an age-friendly city was an ongoing process. It's kind of like the new United Way funding model that changed from supporting and being a United Way member in perpetuity for nonprofits. Now they want you to have 5 years where they support you, and then you go out and you find your own funding and you become self-supported in a different manner. So that's the way United Way has shifted their distribution. And likewise with this was 5 years of support followed by, and I apologize, I'm in a public place because my internet is down. But anyway, so it's an opportunity for St. Louis County to choose whether or not their planning department would want this to be part. That was why it was so critical that we were engaged in that strategic planning. And we weren't brought to the table for older adults were not a priority population. And I think I had sent out the language from each department's strategic plan, but we're a nod in a few places as older adults, but not a true priority population. So I think our role here is to do that. And I think it's most effective if we can, circle back to that, having each department come talk to us and we have some data for them to show them the relevancy, the number of older adults. When we were using the data for age friendly, 45% of the population in St. Louis County was age 45 and older. So that has since grown, that percentage. So at some point, we're going to be the majority older adults in St. Louis County because we do not have the influx of younger adults moving here. So that's where our role, I think, becomes even more important. So I love the notion of starting with transportation. That's a great place. It serves our needs, but it also would help loop them back into the age friendly.
Well, and I think I agree with what you said, Lisa, but I'm not sure that I agree that older adults are not a priority population. I mean, in terms of, looking at kids or looking at whatever. I'm not sure about that because I think you need to look at grandpad funding, which is a pretty significant chunk of money. And I think you also, I think bringing back our legal program showed some priority to older adults because the county's going to be facing serious budget issues coming up, like momentarily. And so I think getting to bring our legal program back right now is a very good thing because that's going to preserve that going forward into our 2023 budget. And that is a priority. So I think priorities, you have to kind of look at, is there a strategic plan that has a section on older adults in it? I don't think so. But that strategic plan changes like every 7 years, I think it is, or 5 years. And it's not, just because it's not in the strategic plan doesn't mean it's not a priority issue. This time it was
Susan,
more.
do you know
employee
what
related.
percentage of the budget is allocated for older adults? I know I talked to Jamie about this, and it's so fractional what older adults receive in St. Louis City compared to children and other priority populations. Do you know what ours is?
No, I can tell you that it's not big if you're going to look at dollar amounts of the budget pie.
Yeah.
But if you look at it, it depends. The street, so the highways, the transportation department gets a large chunk of money. And some of it's fun, some of it's grants and some of it's county and all this. But all those roads are used by older adults. So it's interesting when you argue that, and trust me, I've argued that a lot of times. But it is interesting that they can still say, and as much as I don't always want to agree with it, you have to look at the reality of it, and that is true. So just because it's going to streets doesn't mean it's not going to older adults. I think you could probably look at like with the
I
Department of
think,
Public Health.
and we've had
they
this
could maybe
conversation.
go forward. Yeah. Okay, let's continue it at some other point because yes, please, let's not run past 11 o'clock because I don't know
Yeah,
what happens with this if we do. But yeah, I think we need to look at that.
Yes,
There's other
so we
things
need,
to talk about.
yeah, I think we need to look at that. But there's, I mean, with parks, for example, I think there are a lot of, I was out this morning walking a trail and there were tons of senior citizens on the trail, but
Right.
that's Parks Department. So, it gets a little squishy, but
does.
I want to make sure that we're getting through our agenda. And I did want to say AARPs, if you Google AARP Network on Age-Friendly State and Communities, it will come up, and it is a very robust website. So I think it will give a little bit more flavor to kind of what they accomplish. But to Lisa's point, and I think the analogy with United Way is such a good one, and that is we want to launch you, but we don't want to hold your hand forever through this process. So back to the agenda. Sue, you're still on. I am going to ask if you have an update you want to share.
Yeah, as far as the Commission on Disabilities, we do have a new member. And of course, just like most of the other boards and commissions, we're always on the lookout for new potential members. We really would like to have somebody that represents an agency. That's a missing component from our group. The other thing is the Universal Design draft. It's a draft of the proposal. We had an opportunity, Linda Baker, Cheryl Rose, and I, to review it with Lisa Clancy, and she is the chair of the St. Louis County Committee on Disabilities. And she had some questions on it, and she was going to take it back to her group and get back to us. So, yeah, I get back to us. One of the other things that you were mentioning during your previous conversations, you know, the people with disabilities are also aging. And so I still go back to that, you know, part of my job as the liaison between the County Commission on Disabilities and the older adults is to make sure that we're all interacting, because we do have some similar issues that we really could work well together. Transportation is one of them, that, you know, that sort of thing, housing. So I think we can work well together. Two more little things. Number one, the Governor's Council on Disabilities submitted a legislative poll. I think I sent that to Susan to make sure that everybody, you know, has an opportunity to fill it out. It's not just for people with disabilities. It's really for everybody who might be impacted by the budget and well as the services that the state of Missouri offers. The Brain Injury Association had their annual conference. I was ill, so I did not go. So that's my report on that. Can't think of anything else.
And Sue, I sent out the poll
Great.
to all commissioners. I believe I did that a
You
month
did.
ago.
Great.
So, you know, take some time to fill it out, because it helps guide the decisions on where do we want to put our, where does the disability community want to put their focus in terms of legislation. And I do think there's, you know, overlap to your point, Sue, on, you know, on housing issues, on transportation issues. I mean, we all want the curb cuts. And we all want good sidewalks, and we want this to be a walkable community. So I think there are so many shared areas.
I have
Dave-
one other question. I have another question. This is probably
Yeah.
to Susan. Who is in charge of Olive Street Road as far as repair? It is a disaster. At Olive and
Oh.
Mason is a bunch of potholes.
State road?
I don't know. You think it's a state road?
What is it? Which road?
Olive and Mason.
Oh, I have no idea. That's,
I know you. I'm just saying.
the maze is quite complex.
Yeah, I would call Creve Coeur and
Well, my
Yeah.
husband has, so it's, you know, we don't get any answers.
yeah, well, yeah, I know the challenges.
Yeah.
So, I did want to say, Sue, that Dan Rosenthal, who couldn't be on the call today, is an architect and has a very strong interest in and a very good background in universal design.
Right.
So I sent him the proposal.
Great.
He was.
It's a draft. It's going to be tweaked. The Universal Design Alliance group has a different twist on it. One of their thoughts is not really as detailed as our ordinance proposal. It's really, they call it UD ready, and it's more for retrofitting or rehabbing existing housing. And their requirements are really minimal. So, I mean, it's another twist on that. And I believe the Governor's Council meeting, we're going to be voting on adding that component to our recommendations, you know, on the Governor's Council website.
Sounds good. Well, thanks for the update.
Okay.
We do not have, Jamie isn't here from Senior Fund, so I am going to just immediately go to share out. So Lisa Hotley, you had mentioned you had something for share out, and I don't know if we covered it earlier, so I'm going to turn it over to you.
We covered several of the things. I just wanted to kind of keep you abreast of who we're meeting, and to kind of loop that back in. We all talked about that we had so many areas of our 4 focus areas for age friendly that we all personally had committees and areas that sort of covered all 4 of those areas of focus. So I've been meeting in different areas as well. So in addition to talking about the county, the health improvement plan, and looking at the departments here and the age-friendly nature of St. Louis County, I've also been talking. I met with St. Andrews Foundation board president. I've met with Lutheran Foundation to kind of look at their funding, their programming, and because actually Lutheran Foundation funds St. Andrews as well as some aging ahead programs. For Lutheran Foundations, it's one of their new focus areas. In the last, I think it's been about 2 years now, every 5 years they revisit their focus areas. They added older adults, and so they are funding programs. But one of the things I had reached out to Jamie about was to find out, where are these programs across the region, and are there other opportunities for Lutheran Foundation? We've been talking about funding a white paper to kind of get the state of aging. I don't think I've seen an issue paper on the state of aging, and whether it would be county, regional. Now that Missouri is doing one, the SCAN grant, that's great, but maybe we could get a little more hyper local and find out what these agencies are doing. So as Susan has said in the past, why would I run a program if another one is being run identical to it, when Susan could have, Susan's like core could have these programs, and then senior services have this program. It'd be really nice to kind of know where those gaps are. So I've kind of just been out meeting with people to understand better sort of that interrelationship. The only other thing, and Jamie I thought would be reporting on this, there's a readiness fund that could potentially fund an assessment for seniors count. Right now, it's not very popular, according to Jamie. That probably, if St. Louis County's administration stays the same, it probably won't be on a ballot anytime soon. So, but the readiness fund, founded by Missouri Foundation for Health, might be available to do an assessment. So sort of a readiness assessment, whether the community would be considerate, or at least to begin an education process ahead of even looking at putting seniors count back on the ballot. I think that's all I have. Oh, Missouri Parks Department contacted me to speak at their conference in February, and I'm in talks with them. I wanted to do an age-friendly slant. That's not what they asked me to speak on. So if I can, we'll get some plugs in, and then I'd love to model St. Louis County as an age-friendly community. So I'm kind of excited that everybody is interested in the age-friendly concept. And Susan, I'm excited that you're seeing the interest in older adults countywide. That's just really exciting. So that's all I have.
Great. You've been busy. Thank you.
Yes, I have.
Wayne, have you got anything?
Well, just to mention that I plan to attend the circuit breaker session on November 14th along with Carol and then perhaps Susan, but I will do a summary of that and just give a brief summary for the commission, either at the next meeting or before then. But all of that would be pertaining to what they're hoping to do in January and early next year.
Liz, you got anything?
I think that kind of supporting Lisa Otley and a lot of her things. I did attend a program on ageism, and just got another thing on ageism on something else. So kind of I've always known it was out there, and felt it was kind of uniquely, not uniquely, but it's more prevalent in the United States than it is in other countries that I'm familiar with, and how that is being kind of brought to more people's attention as something that is a problem. So I will continue to learn more about that.
Good. Keep us posted, Liz. We appreciate it. Susan, any pearls of wisdom that we didn't cover?
No, none at all. No wisdom.
Okay. Mac, did we do okay?
You guys were great.
Well, we appreciate your being present and providing some guidance for us. And we are going to wrap up in a timely manner. Our next meeting is December 1st. So we will, Susan is not going to be at that meeting because her daughter is getting married. And so she has other things on her agenda that day.
Exactly.
I think we will have someone, who did you say you thought would fill in? Oh, Linda.
I think
might.
Linda. I'm not sure who will do it, but Linda's aware that I won't be here, so.
But we will,
Congratulations.
yeah.
Thank you.
We will, Susan and I will work on the agenda and the minutes and try and get that out ahead of time for everyone. I will talk also with Susan about someone from transportation, if not for the December meeting, for the January meeting. And
Are you going to do that, or do you want me to do that?
if you would do that, that'd be great.
I will definitely do that.
Okay.
I've got it in my notes.
Okay. And I think other than that, we have several things going on, which is really nice to see our engagement and our continued engagement in issues that we've been working on for several years, and the success and new initiatives as well. So thanks everybody for your huge level of commitment to our group. And hopefully next month we will have a quorum and be able to vote on our minutes and look at some other things as well. Any final words from anyone?
May everyone survive Election Day.
Yes, yes. I will put a plug out there for voting early. It went smooth as silk for me. So if other people want to choose to do that, I found it lovely.
Yeah, I did the same thing yesterday.
Yeah, which I
It
usually
was-
don't
it was
say about
really
voting,
easy.
that it was a lovely experience. But yeah, Boone County Library, they were very efficient. Okay, bye everybody. Have a great day. Enjoy 80-degree weather.
Happy
Thank you,
holidays.
Carol.
Thank
Bye.
you.
Bye-bye.